Welcome to my YouTube channel. My name is Livina and I'll be your instructor. Today we are going to talk about the use of bedpan. What is a bedpan? It is a container used to collect urine or feces either from a female or a male patient. Those patients that are confined to bed, and this bedpan is shaped to fit under the person lying or sitting in bed. A uriner is another device used to collect urine, especially from the male patient. Now, question that I want to ask right now is, which patient will need bedpan? Yes, a patient who is unable to get up to the bathroom to urinate or to defecate. These are patients that need what? Bedpan. Now we're going to start reading again from Prometri's clinical skill test checklist. So we'll start from number 3 of this checklist. Now place protective pad on the bed over bottom sheets. Now some students, they make this mistake because they know, probably because the person is not actually gonna urinate or defecate. Please don't forget, remember when you are doing these skills, this is skills, but you know you're gonna do it in your facility, wherever you're gonna get job. You want to use bed protector so that if anything spill, you protecting that patient sheet. You need a bed protector. So one of the supplies you're gonna gather on that day is what? Sheet protector, either disposable one or the washable one. Now place and remove bedpan by either by having resident position on side or the patient to raise his hip off bed. Now position bedpan under resident according to form or shape of the selected bedpan. Now I'm going to show you what the bedpans that I have here. This one is bedpan, and this is called a fracture bedpan. This is the regular bedpan. So on your ski day, you might see these two, but please don't take this yellow one. This is fracture bedpan, and these are used for patient that had a hip fracture or those ones recovering from hip replacement surgery. This is the one you will use for your skill. And again, I mentioned about urinal. This is urinal, the one the male patient can use to urinate while they're in bed. Now we're going over to number 5. Position bedpan under resident according to form or shape of the selected bedpan. I've said that. Position bedpan to allow for collection. Yes, when you position the bedpan on your patient, you want to make sure it is comfortable. You want to make sure it's positioned so that the feces, the urine, will be collected in this bedpan. Sometimes when you put this bedpan and if it's not properly positioned, you see the whole thing is gonna be on the bed. Right? Number 7. Raise the head of the bed after positioning the resident on the bedpan and lower the head of the bed before removing bedpan. Now remember, this person is lying flat. After you put this bedpan, you want to raise the head up, just so that the person will assume that position of a person using the regular toilet. Now, after the person is done, you want to put the head flat before you take it out. Now, number 8 said, ask resident to call when finished. Is the patient going to call you if you don't give her the call light? Now, critical. You want to make sure you have that call light within reach so that the patient will call you when he or she is done. Number 9 says, leave toilet paper within resident reach before leaving residence to use bedpan. Remember, this patient is going to clean him or herself, so you want to make sure you have toilet paper within that person's reach. Wear gloves when removing bedpan and while emptying and cleaning bedpan. Infection control. Who will do this without glove? I hope nobody will do it. Empty content of bedpan into toilet. Rinse bedpan, pouring content into toilet, and dry bedpan. Yes, it is bedpan. Remember what it is used for. Because we are doing skill, we are not actually poo-pooing or having urine inside this bedpan. Remember, it is feces. It is urine. Who urinates inside the sink? Who defecates inside the sink? Nobody. So treat that anything inside that bedpan as urine. And nobody will pour urine inside the sink. So make sure you pour them inside toilet. I'm telling you, some do this mistake. Now, offer resident damp washcloth or paper towel or hand wipe to clean hands after bedpan use before the end of the care. Who cleaned the patient after the patient finished using the bedpan? You, the CNA, or the patient did? Remember, the patient cleaned him or herself. If you clean yourself, do you wash your hand? If the answer is yes, then the patient has to wash his or her hand. Remember, they can't get out of bed. That's why they're using bedpan. So you need to provide something for them to clean what? Their hand. Damp washcloths, all right? Paper towel or hand wipes. Complete skill, storing bedpan and toilet paper, placing soiling in a hamper, and disposing of what? Trash. This is when you start cleaning your work area. Now keep resident position a safe distance from the edge of the bed at all times. This is safety. You don't want the person to roll out of bed. You don't want that person to fall during this skill performance. All right? Now, I've mentioned it earlier. Do not use fractured bedpan for your skill. Fractured bedpan are smaller than standard size bedpan. They have one flat end. These bedpans are designed for patients who have what? Hip fracture. Now, let me ask you this question. Residents are most likely to feel the urge to use bowel movement. When? Is it before food, eating a meal, or after eating a meal? Just like any other human being. Yes, after eating a meal, that's when patients get that urge to use restroom. Now, if you have a patient who is in bed rest, right? The person cannot lift his legs for you to put that bedpan. How will you position the person while giving him the bedpan? Yes, on his or her side. Remember when we read on the skill checklist, it said it's either you position that person on her side or the person will lift his hip. So for those who cannot lift their hip to put this bedpan, put them on the side and then assist them with this bedpan. Now, when you are giving somebody bedpan, either for urine or for feces, when you take the bedpan off, do you check and see if there is abnormal color, abnormal odor from? We know the normal color of urine. Somehow light yellow, clear color. Yes, if it's cloudy, smelling, do you think it's a normal urine color? or maybe you have some blood in it, or is tea colored. These are abnormal colors. And what will you do if you notice any of this? Report to your nurse. What if his feces is foul, smelly, watery, slimy stool? Is it normal for that patient? No. Report to your nurse. What if you have this patient that cannot even clean themselves after they use this bedpan? What will you do? Clean them. Provide perennial care. While you are doing this perennial care, you are helping this patient break down. You're helping them not to get infection. All right? You don't want to put bedpan on overbed table. No. You want to make sure after you rinse, make sure you pour anything from this bedpan inside the toilet. All right? So, then positioning. Remember, this bedpan is not comfortable at all for this patient. You want to make sure you answer their call light as soon as you see that call light. If you leave this bedpan for too long on this patient, it might cause skin breakdown. And what will it lead to? Pressure sore. We don't want that. So I think that's a little tip I can give for this bedpan for today. Thanks for watching. I hope you enjoyed this lecture. If you do, please subscribe and hit the notification button. And good luck in your exams. Thank you.